So the last slide on employment in terms of just providing strategies, from our experience at the RRTC, which is the Rehabilitation Research and Training Center at VCU, some of the things that we've informally found helpful when talking to employers is in this bulleted list. So the first one is start at the top. So get an active vocal support from leadership. So you don't want to start, at the supervisor level when there's maybe 4 or 5 people above that supervisor who's working with your client that has a developmental disability. You really want to go straight to the top and make sure everybody's clear about what supports and strategies you'll need, because the trickle-down effect will be most effective. Secondly, we call it finding the champion. So you want to find somebody who's accessible, well-known, a problem solver, and a doer. So not just the person at the top, but then when you need a go-to person, because the person at the top probably doesn't have a lot of time for you. You want the person that's the intermediate to be somebody who you can kind of always contact, that pretty much people know, because well-known people get things done. And, you want, of course, them to be that person to get things done. So kind of target in on who might be the best person for that job. And then you can sort of volunteer them, I guess. Certainly discuss it with them, but you're kind of targeting them. You want to get involved no matter who you are, whether you're an employment specialist, again, a parent or educator or whatnot. You want to be the disability expert the company goes to. So we talk again about different resources, taking visual supports, having clean language summaries, whatever those might be. You want to be the person that knows how to access those, who's published them, how to make them, offer to make them, be the person that gets involved. And then also attending leadership forums, and certainly that depends on if you have access to the business. So if you're a vocational support provider, you might have access to this, but join the team meetings and be a presence. I'm going to caution there though, because I know I've had some clients I've worked with that have DD that don't really like us to be overly involved as vocational support providers. They feel like we're stepping on their toes. So while it can be extremely helpful, make sure that they're on board with that, particularly the transition age students. They're kind of in the finding themselves as adults phase and don't like you to hover. But I will say it can be really effective if they are on board with that. And then, of course, being responsive and attentive. So knowing the business culture and then responding immediately to concerns. So particularly during a pandemic, if you've opened up the line of communication for a business and have said, let me know if this person is really struggling to meet the new protocols, I'd be happy to help with a visual schedule. Just making sure that you do a lot of follow through so that you don't break that trust. I'm gonna get a quick sip of water. I'm talking a lot. So support strategies for education. I think that these are just generally good strategies for a pandemic or not, but based on the literature and some of the experiences of people I've talked to, this is sort of the compiled list. But establishing a plan for continuity of educational services. So we do now know that there could be a sudden break. And so having a plan for that can be really helpful. And there's a lot of different ways to do that. And the rest of these bullets sort of encompass that. So for example, proactively plan for technology failure. And I mentioned that a little bit early, but the systems were really inundated and a lot of times crashing. So having alternate assignments or ways for individuals to complete work, or juggling a schedule, for example, so that they can get work done, is really ideal. Having extra materials to be sent home on short notice. And this isn't necessarily just mean educational things, but also communication icons or picture schedules, things that help the student really understand what the structure of the day is, how to express wants or needs, things that they ideally have to have in the classroom setting that they probably don't have at home. And I do say that with caution because, again, I've worked in schools and I know that short staffing is a real thing. And so, it is quite easy to say that you should have all of these backup materials made. And I know that that isn't always plausible, but to the extent possible, having them can really alleviate some of the discrepancies we saw in access to services. Developing student informational resources about specific students. The reason that we mention that is simply because with the pandemic, a lot of staff were having sick days. Substitute staff were filling in either from different classrooms or elsewhere, and those staff don't know individual students. So having kind of a cheat sheet about maybe some of the things the student likes to work for or some of the communication supports they need so that staff can catch up as quickly as possible and sort of iron out kind of a gap in services. In the interest of time, I won't go into detail on all the rest of these, but they really just look at sort of meal distribution, so making sure, you know, if students are in a lower socioeconomic status and are dependent upon meal service, to make sure that their schools are providing alternate access to that. It's obviously difficult for kids to learn if they are hungry or their basic needs aren't met. And that was certainly something we saw as an issue during the pandemic. Developing a communication system with parents, also scientifically tracking data. And then the last one I just will focus on. So establishing online resource banks. A lot of teachers do this. If you are a teacher, you probably have a great way to do it, maybe even a platform you use that you find most helpful. Feel free to put that in the chat to share with others if you do. But a lot of these resources, like I said, I know schools are short-staffed, and so we don't want to spend time recreating the wheel. So if you find informational resources or you make schedules or templates that are really useful, creating sort of like a collective hub so that everyone can access it, so that you're kind of compiling efforts. I think a lot of teachers felt very isolated in doing it all themselves. And I think finding a way to kind of cut down on that can be extremely helpful in the event that something like this happens again. Okay, so future directions. There's a lot of future directions. So research in particular, we are looking forward to what will come out again longitudinally to give us a better idea of the impact long term. We also want to focus on more information dissemination. We don't really know now if the right information is getting to the right individuals or if it's getting to those individuals in the right or preferable formats. So we want to make sure that we do some investigating to make sure that that is happening. We also want to be creating an assembly of advocates, and that really ties into the fourth bullet point there for policy. So we want to make sure that policies in the future accommodate some of the necessary support and services that are needed to bridge the gap in the event of a disruption in services. And then lastly, I just want to throw out personal accountability because that involves all of us on this call. So there's always ways that we can be bettering ourselves to be more supportive. And again, as a stakeholder who interacts with many other stakeholders, just asking ourselves what it is that we can be doing to try to open the dialogue with other stakeholders, perhaps suggest effective strategies or encourage effective strategies, or be the person that needs to employ better strategies. So sort of just doing accountability check with yourself to make sure that, that we're all doing the best and the most that we can. So the last part of our presentation is going to focus on some different resources for stakeholders. There is a lot of resources that have come out, and so we certainly aren't extensively covering it, but we selected two that I think are really helpful and useful and might give you some direction. I'm going to turn it over to Hannah first, and I think, Hannah, I need to let you share your screen right now, don't I?
Yes, I'll go ahead and share my screen.
Okay.
So the first resource that we wanted to share with you is provided by the CDC. It's actually a newer resource. They have put together a toolkit for people with disabilities and their support system to help make decisions and learn about, COVID risks, as well as vaccine, mask requirements, other things that might be able to help them, navigate this difficult time. So this toolkit has a wide range of resources. Like I said, there is plenty of resources for caregivers as well as for individuals with developmental disabilities and other stakeholders. So you'll see it's divided by featured resources, focusing on vaccine information at this time. So making a decision for the vaccine and talking, with people with disabilities, how they're going to access it and why it's important to get it and things like that. So you'll see here they've got, websites, PDFs. What we thought was really interesting were some of these web resources. They have posters and social stories, as well as videos. They've also, added a lot of easy to read, is what they call it, so plain language summaries and information. So you can see, a little bit of a preview with this website. With this page, and this is the link that we included on the PowerPoint, but I'm going to go ahead and switch to this one here that you can also find on the toolkit page, because I thought this was really, really a good resource for a variety of stakeholders. And this is COVID-19 materials specifically for people with intellectual and developmental disabilities, and they are available in English and Spanish, which was a great decision. And here's where you can see that there are social stories, interactive social stories, or videos. So depending on how the individual with a disability prefers to learn, what avenues are better for them. They provide a variety of options, all in plain language summaries. And you'll see there's vaccine information, hand washing, COVID-19 tests. That was, a very interesting thing to navigate, especially, when you go for your first one, what to expect for anybody was a big source of stress. Masking information, social distancing, and then information specifically for caregivers. So a caregiver tip sheet, as well as a provider tip sheet. These you'll see here the guide for caregivers. They again break it down and explain what resources are available provided by the CDC, and tips for talking about COVID-19, and all sorts of other links and resources. You'll see here, this is one for providers. So a lot of what, Lauren was talking about when it comes to support strategies, make it easy to understand, say it in different ways. Words aren't always the most effective if somebody is more of a visual learner. And, there are resources, as Lauren also said, we don't have to reinvent the wheel today. We know that everybody is navigating as best they can, but there are resources available to help where they can.
And I just want to interject a little bit, Hannah. So again, if you're kind of thinking, well, this isn't that unfamiliar to me, I certainly know how to make a visual schedule or any of these documents. Keep in mind that's part of this whole collaborative stakeholder theme that I'm going back to. So this might be something, for example, like the social story or the poster that would help you distribute this resource to somebody else in a different stakeholder category that doesn't really know that. So kind of keep in mind they're just ready-made resources to pull that might really help a healthcare provider when you go into a meeting or something like that. So kind of think of it as something you can use to distribute if you don't necessarily find it novel yourself.
That's a great point, Lauren. I think it's back to you.
Okay. Can you see my screen here? But okay, perfect. Oh, hang on just a second. Okay, so the resource that I'm going to briefly talk about is from the NACDD, the National Association of Councils on Developmental Disabilities. And this is just a published report. And it looks at some 4 major problems that were outlined by the pandemic, and then some of the different solutions that states and entities have used to combat those. So I'm gonna just, and let me go back really quick because I apologize. So the links to these are in the presentation. So if you do want to find either what Hannah was just talking about with the CDC or this one, you can access that. So this is the actual report from the NACDD. And so I'll just sort of scroll down to give you an idea, and that way you can decide whether it's something that would be helpful to you or not. But it looks at the major problems found during the pandemic. And the 4 of them were a plain language communication, which we keep talking about here, but basically that there's a huge need for information to be provided to individuals with IDD that is in multiple formats and ways that is preferable and understandable. The second is this idea of a digital divide, so that when the pandemic hit, individuals who were tech savvy really had an easier time adjusting because they could work from home, and they could also keep in contact with family members or access health appointments. And those that were not tech savvy or did not have financial access to technology really suffered in ways that those that did have it didn't. So the digital divide was really recognized as an issue. PPE, personal protective equipment, was the third issue that they identified. And that goes back to not only what Hannah said about making sure that individuals with IDD are using and understand how to use these types of equipment, but also that the people that work with individuals with IDD, so those that are direct caretakers and cannot do activities with them from 6 feet away, like helping them with getting dressed or bathing or whatnot, that those individuals really needed access to PPE in order to provide continued necessary services for individuals with IDD. So it became a huge issue in terms of making sure that support providers had what they needed so that there wasn't an issue with services. And then lastly, Medicaid. So this is getting at what was being funded and whether or not what was being funded was meeting the current needs of individuals with IDD based on the changes that occurred because of the pandemic. So just as a quick example, if an individual was at high risk for contracting the COVID-19, would telehealth be covered if they could use that suitably? And so this question of, was Medicaid covering the things that needed to be covered in lieu of pandemic changes? So those were the 4 major issues that sort of came about. Again, plain language communication, the digital divide, PPE for caregivers, and then funding. And then this report just basically goes over a few of the ways that, I'm going to scroll down here, and there's lots of ways that states and entities address these. These are just a few examples, and I think they're good to review. And I'll go by the different for problems. So the first one is plain language communication. Vermont and Wisconsin are highlighted here in the different ways that they provided resources. Hannah mentioned the CDC already, but here in this gray box, you can see an example from Vermont where it says GMSA put together a series of COVID-19 documents in plain language. So part 1 through part 9 that's listed there gives you the topical categories of each of these plain language communication summaries. And then Wisconsin did something similar. They actually did an entire COVID-19 toolkit. And if you look at the bottom of this page, right above that red bar, you've got references along with a link. So you can access both of those. So you can get this report from our PowerPoint, and then as you read through, you can also get this toolkit and also these resources to use for yourself. So just to reiterate, there's quite a bit of different existing resources out there. So before you go and kind of take time making your own, there's a lot to pull from that are really great and easily accessible. And these do tend to be updated pretty regularly. The second is the digital divide. This one I found really interesting. So Maine and Kansas both looked at this discrepancy in technology, and they handled it 2 different ways. So Maine received funding to provide iPads. 148 iPads were bought at discount through Apple and then distributed to try and kind of alleviate this digital issue. I'm going to scroll down to Kansas because Kansas essentially did the same idea, but with smartphones. And so they use smartphones with prepaid service cards, which between the smartphones and the iPads really helped individuals with IDD, again, stay connected to family members, access healthcare services if something went wrong. You know, it didn't mention if they use these for employment, but certainly they could be. So, you know, I know that funding here is kind of a necessity for that, but that there are initiatives that were successful to try to decrease that digital divide. The PPE, so I'll just go over Massachusetts and California. Massachusetts organized a coordinated distribution. They basically made sure that there were X amount of PPE equipment distributed to specifically to providers that were giving in-home care and other types of services. And then California did what they called a pipeline. So it was almost like a drive-through so that eligible people that were providing again, direct care could easily access the PPE they needed so that they didn't have to stop or delay services for daily health care needs for individuals with IDD. And then lastly, I just want to talk about so funding for different services. So the restructuring in funding, Arizona and Tennessee are the 2 highlighted here. I mentioned the telehealth earlier. So Arizona basically describes a situation where different types of related services, so physical and occupational therapy, day programs, other habilitative services that, or even through telehealth, where these weren't covered before, they work to create sort of temporary funding opportunities to meet the needs of individuals during the pandemic. And then Tennessee did something similar with funding. So they worked to approve temporary measures to keep caretakers working. And some of the ways that they did that was through temporary rate increases and also easing up on some of the stringent protocols that had been in place pre-pandemic, like allowing medication supervision to occur remotely rather than in person. And again, these were all just efforts to try to decrease this huge discontinuity that service providers were able to give based on the change in in the way services were conducted as a result of the pandemic. So if I scroll down here, there's certainly more to this, but again, you have access to it in the presentation, and we're getting towards the end here. So that was actually it for us. We will enable anybody who has questions to go ahead and put those in the chat. And then also we have at the end here just our contact information. So if you do have questions or want more resources, you can email either one of us and we'll be happy to get that out to you.
It looks like we do have a few questions. This this first question is from Roxana. Here in California, many service providers have voiced concern over not being able to support individuals at work because of the lack of support staff, which has hindered progress in getting individuals back to work. And then the question is, how have staffing shortages been mitigated within vocational rehabilitation service providers?
So I think that's a great question. I think that's something that a lot of organizations are struggling with, again, in every field across all of those different life domains. And I think we don't really know now what the most effective solution to that is, but the differences in efforts kind of in that report that I just mentioned reflect things like trying to be more flexible about who can provide those services, how they can provide those services, so that it's not a matter of manpower because of red tape. In instances where, of course, people are nervous about their health to come to work or are out because they're sick, that's where I think the most challenging efforts are, because there isn't really a great way to just replace manpower. But from what I can understand, and in terms of my experience, it's really mainly been trying to address it again through the removal of some of the red tape, so that, like, I think the last example, and I think that was California actually, who really looked at the flexibility in how to fund services, and things like the medication supervision being remote rather than in person really entices people to be able to more manageably perform duties. And that's not just because of risk of health, but also because so many people during the pandemic had other responsibilities and simply couldn't leave their homes to fulfill a lot of their previous employment duties. So I wish I had a much better and succinct answer for you than that, but I think right now what's coming out is a lot of just initial strategies. And I do want to throw that out, though, to anybody who is on this call that has found something successful with their agency or knows of a state or organizational initiative that's really moving, to please share that, because I think this is the opportunity for us all to get to know better answers if there are some.
We have another question, and this question is, although the suggestions for physicians were excellent, it is also important to reach out to the hospital system administration, as they often inform physicians and other healthcare providers how to manage different units. It is rare that physicians on the unit can make such stark decisions without input from administration. And the question is, who should be contacted within a large hospital care system to make sure care is just and fair?
So that's a great question. And so my best answer for that is, if you look at the different stakeholder categories, I would almost assume the administration is the business. So rather than looking at some of those stakeholder strategies for healthcare, switch over to the suggestions for businesses, because they do operate like a business and they think like a business. And so one of the slides that came after so it was a list of support strategies for businesses that is in the original article. There's kind of a supplemental slide where I talk a little bit about, find your champion, find the knowable, relatable, doable person. You want to make sure that you're building a relationship from the top, but that you also have that liaison that can get things done. Because once you have buy-in from the top, you've got momentum. But again, the people at the top probably don't have the time to really work with you. So you kind of want, again, that trickle down effect. And once you get that person that is the doer and the problem solver, that's when you want to use those business strategies that we mentioned. So open communication, information dissemination, make sure that you are working with them to install different supports, whether those are communication wise or visual, being available to provide maybe educational talks or whatever it might be. So I won't ramble on about that, but I think my best answer to that is to really revisit how you conceptualize that stakeholder. And I think once you move out of the direct care providers and into administration, you're really looking more at the business strategies.
This next question is, are mid-level providers being educated about autism as well?
Is that mid-level healthcare providers?
I believe so, because it's a follow-up from the previous question.
Oh, okay. So in general, what we find is that there isn't a lot of specialized training within the healthcare community about specifically individuals with intellectual and developmental disabilities. So a lot of physicians have from what we've researched and talked to, because we've done a few different probe projects about this. It's a topic that's near and dear to my heart. What we find is they have sort of like continuing education webinars or seminars, or sort of like information briefs that get sent out. And they all do rotations on, for example, like a behavioral unit, but most of them don't have extremely concentrated training. And this is true even of individuals that work in pediatrics, and that's really at all levels. So it's from the physicians all the way down to the nurses, physician's assistants. I don't really know what the intermediate healthcare comprises as a term, but again, at all levels, we're really seeing that they don't have specialized training. And so it's kind of something that was exacerbated by the pandemic and has been a good stepping stone for us to really pivot and move forward. But the best efforts I can mention, and it is, I want to say it's Columbus, it might be Cincinnati, it's somewhere in Ohio, the initiative to really start embedding a lot more concentrated training about how to actually provide services that are effective to not necessarily children. A lot of times with pediatrics, what we see is that parents already act as a liaison. But when you get into older adults, so young adults and older adults who still have those communication challenges, maybe they're in their 50s and their parents are no longer with us and they don't have a sibling who can be a liaison, and they really are at the whim of a care provider or a residential support staff. Those are the individuals we really need to be able to have healthcare providers say, oh, they might have an alternate form of communication. Maybe I can tap into that. I need to be more vigilant that I'm understanding what they're expressing to me and that they're understanding receptively what I'm expressing to them. So it kind of circles with your question, but I think regardless of whether it's intermediate or not, I think all levels really aren't getting training in that area. And as of right now, the medical community is completely overwhelmed. And so going in at this point and saying, we really need you to have extensive training on this just isn't going to happen. So for sort of a temporary solution, the best we can do is case by case, try and offer our knowledge as bridges until they're a bit more out of the weeds.
The person asking that question followed up with mid-level, referring to NP, which I think is nurse practitioner, perhaps,
Yeah.
and PA, which would be physician assistant, I believe.
Yeah, so physicians assistants and nurses, it's all levels. I had a personal experience that I shared with Walt and Hannah, where I actually ended up at urgent care. I am fine. I got stabbed by a rose bush and ended up in an urgent care center, and I talked to a physician's assistant there, and of course he asked me what I did, and I sort of told him and that what my line of work is, and he got very interested and said that he had an experience the month before where an adult, just like I had mentioned, a man who was in his late 40s had come in and had very limited verbal communication skills, and the person that had brought him in was somebody who was a direct support staff, had only been working with this individual for less than 4 months, didn't know that much about him. And the urgent care physician's assistant really said, I didn't feel like I provided the support that I should have. And it's because I didn't know how to communicate with him. And that really bothered me. Do you have any resources that could help? And so we got into a conversation about that. And since then, I've really looked into how this problem in terms of scope is and what might be a remedy. And so essentially the information that I just mentioned to you in terms of how it's not really a targeted concentration for any level comes out of recent conversations and discussions I've had with a variety of healthcare providers. So we do know that it's something that that they're interested in, but again, they've all sort of said now is not the time. They're just too overwhelmed.
We have another question, and this question is, I know we already heard about the technology generally needed for education and employment during the pandemic, but were there any significant findings around those living in rural areas without limited internet bandwidth and access, or with limited internet bandwidth and access?
There's not any studies on that I have found, and I've looked pretty extensively through the research for that. I would imagine that's a topic that probably will have some light coming out in the future, and should, because again, the research has been really broad. We don't have a lot of specifics in terms of just demographics or, region, but we need that in order to move forward, not only to see who was impacted most difficultly, but also who's most vulnerable to get to first next time if something like this were to happen. I think that the issue with technology really gets back to what I mentioned in that report, and that's funding. VCU does consult with schools, and we work through different platforms. So Torch is one of them, but it's very expensive. It's license-based. And, not all schools have access to that, can fund that. And then, of course, as you're mentioning, not all on an individual level, kids have access to internet or stable internet and that sort of a thing. So as of now, we don't have any specific research coming out, and the schools that I work with that are more rural in Virginia, where in Virginia, of course, they've really not experienced what I would say is probably what you're getting at. So I hate to say I don't have an answer, but I don't have an answer for you.
Thank you. That was the last question.
Well, thank you for everyone who is out there. And if you do have further questions, you can certainly email us.
I would like to thank our presenters for this tremendously timely and relevant presentation. It's been an honor and a privilege for our presenters to join us today. I would also like to thank everyone for joining us today. Be well and stay safe. Thank you.
Thanks, Walt.
Thank you all.